Attention nurses. Want to win some amazing prizes? From scrubs to stethoscopes, shoes, and even cash, Nurse.org has giveaways just for you. Don't miss out. Head to Nurse.org/win to see the latest giveaway and enter now. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome. In today's podcast, I will answer the question, why should you consider advanced practice psychiatric nursing? I have had the pleasure of being an advanced practice psychiatric nurse for over 23 years, and it's been an amazing journey. I've had the pleasure of serving as an educator, a nurse entrepreneur, and a clinician. You know, my journey started so many years ago. I had started as a nursing student and had an opportunity to have a clinical experience with a patient. And this patient was dying of cancer. And all the patients on the unit called her Red. And I just remember thinking to myself, I wonder why they call her Red. I did notice this very bright lipstick that she wore every day. And so one day, my preceptor assigned me to work with Red. And this particular rotation was a rotation focused on medical surgical. And of course, she was receiving treatment for her cancer. But I just remember being struck by Red. And I sat next to Red and I asked her one day, I said, can you tell me why they call you Red? And Red shared that she was dying. And I don't think in that moment I had ever met someone who could physically and verbally say, I'm dying. So that struck a chord within me. And she said, yes, I've lost everything. I've lost my family. I've lost my job. I've lost the opportunity to provide for my family. And it's been hard. And she said, you know, red lipstick is like my superpower. It's what wakes me up every day. It's what's make me get up out of my bed, brush my teeth, and eat. Red lipstick is my superpower. And so I looked at her and I could tell by her story that she was in deep emotional pain. And I asked her and I said, Red, can you tell me, are you depressed? And Red looked up and she said, yes, I am. And I asked her, have you told anybody about this? And Red said no. And in that moment, I just wanted to hug. I wanted to provide care. I wanted to get services for Red. And I did. I worked with the unit to do that. But sadly, when I returned the next week to provide care for Red, Red had passed. And so Red has kind of been a symbolic part of my personal journey. It is what has driven me to return to school and to obtain my master's, and then later my doctorate in nursing, and is what continues to inspire me to speak on podcasts like Nurse.org and to talk to as many people as I can, because there's such a need for practitioners to specialize in psychiatric care. I talk about this need often because outside of owning a community mental health clinic in Massachusetts, we're located in 2 sites. We provide care to about 2,500 individuals across the lifespan. But besides providing that care, there's also this need for educators. And I have the opportunity to educate students through my online graduate nursing program at UMass Amherst. And we provide education for folks who are interested in their doctorate, but those that are out there as nurse practitioners and other specialties that might be interested in exploring psychiatric mental health nursing. So it's truly been my honor to educate tomorrow's future as a professor and a director of an online program, and also to support diverse communities with psychiatric mental health care through my community mental health clinic here in Massachusetts, as I stated. And so I want to talk more about the role of advanced practice psychiatric mental health nurse practitioners. And I especially want to speak to those of you who maybe have been doing psychiatric mental health care in your settings, because I always share with my students, all nursing includes psych mental health. You truly can't provide care without being present, actively listening, and supporting the patients you're with. So whether you believe you're a psychiatric nurse or not, you're providing that care. You're being present. 80% of our communication is nonverbal. So we truly need to be present, actively listen, and to utilize so many different strategies in the care that we provide. And certainly, a career in advanced practice psychiatric mental health nursing is a way in which we can continue to provide care to our patients, being especially attentive to their mental health. So advanced practice psychiatric nurses are also known as PMHNPs, so psychiatric mental health nurse practitioner. And PMHNPs are registered nurses who've completed advanced education at the master's or the doctoral level in psychiatric mental health nursing. So, how long is the schooling for aspiring PMHNPs? So in order to become a PMHNP, you need to at least have a bachelor's degree. And the BSN nurses must complete either a master's or a doctoral program in nursing. For those pursuing a Master of Science in Nursing degree, that typically takes about 2 to 3 years of full-time study, while a Doctor of Nurse Practicing degree can take an additional 1 to 2 years if pursued after a Master's of Science in Nursing. In addition to obtaining a degree, candidates are required to complete a specific number of clinical hours to pass a national certification exam. And at some universities, that might be 500 clinical hours over a certain set of years. It could be 750 or even 1,000 clinical hours at the point of graduation, at which point they can then register and apply for a national certification exam. In some states, that's through the ANCC, and other states, it's through the AANP. And some states, it's both. But in order to practice, you do need to gain certification, fulfill the state licensure requirements before beginning to practice. So what exactly is a psychiatric mental health nurse practitioner? Psychiatric mental health nurse practitioners are trained and they're certified to diagnose. They also provide assessment. They manage treatment for individuals throughout various stages of life. They provide care for a wide range of mental health issues. This can be including psychiatric disorders, substance use disorders, and other mental health conditions. Their role truly does span across the lifespan. So from a young child to an adolescent to an older adult. In these roles, they provide therapeutic support. They can also provide medication management and individualized treatment plans to address diverse mental health patients, according to the American Association of Nurse Practitioners.
Enjoying this episode? We want to hear from you. Share your feedback and support your favorite host by completing a quick survey, and you'll be entered for a chance to win a $50 Amazon gift card. Head over to Nurse.org/podcast and let us know what you think.
So, what exactly is the need for the role? Why are we even talking about this? Today, there are more than 385,000 licensed nurse practitioners in the United States. But of this number, only 25,000 of these NPs are considered and certified as advanced practice psychiatric nurses. This means and translates to about 6.5% of practicing psychiatric nurses in the United States. So again, out of the 385,000 licensed nurse practitioners, only 6.5% are practicing as psychiatric nurses. So 270,000 are practicing in the role of family nurse practitioners. So of all of our advanced practice nurses, only 70% are doing family nursing and only 6.5% psychiatric nursing, and the remainder are other specialties. As you can hear, FNPs are playing a critical role in providing comprehensive care across the lifespan and for caring for a range of family, medical, and psychological issues. I'm so grateful to those of my colleagues out there who are providing this essential care to those in need, but I have to stress this importance of gaining more specialty in psychiatric mental health nursing and hoping more of us will consider exploring this field. So, what does that mean when there's such a psychiatric number of providers? What does that mean? Well, today, according to the American Psychological Association, approximately 75% of antidepressants in the United States are being prescribed by primary care providers rather than by a psychiatrically trained specialist. Primary care providers are currently serving as a first point of contact for those seeking mental health care. In fact, it's estimated that 75% of primary care visits include a mental and/or a behavioral health component. Thus, there is a great need for more advanced practice psychiatric nurses. So many occasions I speak to clients who tell me they've been going through something for many years before they ever step into my outpatient mental health clinic. But when you look back at the history, perhaps they've gone into primary care because their blood pressure was elevated, and/or they couldn't sleep, and/or they were overeating. And when we dig deeper through therapy, through questions, evaluation, we note and learn that perhaps they were treating their anxiety, they were treating their worry, they were treating their depression, they were treating their restlessness or their inattention. And so the need is great. And so much of this can often go undiagnosed. And so much of this, as you've heard, has been being treated in a general primary care setting. It is estimated that 158 million people in the U.S. live in areas with a shortage of mental health professionals, underscoring this urgent need for more PMHNPs. So what types of settings, if you're interested in thinking about exploring this career, may you work in? And what is the salary range? So the salary for psychiatric mental health nurse practitioners can greatly vary. And this variation differs based on factors like the practice setting, the geographic location. According to various data, including information from the American Association of Nurse Practitioners, PMHNPs are employed in a variety of settings like outpatient care centers, substance use and prevention centers, urgent care, integrative health and medical centers, private practice, and at community mental health clinics like the one I have the pleasure of directing and providing care at. PMHNP's annual income can range. It can range from $137,000 and up. But again, please note, these figures are estimates and can certainly vary based on factors like the number of years of experience, state-specific demands, and additional benefits such as bonuses, health insurance, or other incentive programs. Thus, PMHNPs can enjoy a competitive salary. So considering a career as a psychiatric mental health nurse practitioner is a compelling choice, especially given the critical need for mental health providers today. As a PMHNP, you can be part of the solution by providing much-needed care to the underserved and improving access to mental health services. The financial stability, combined with the opportunity to have a profound impact on patients' lives makes the profession both lucrative and deeply fulfilling. I'm so grateful to you today for listening in and exploring why you should consider an advanced practice psychiatric nurse as a role perhaps in your future. I encourage you to go online to seek out different programs that are offering academic tracks to see what might be a good fit for you. In today's nursing world, you can attend many universities and or colleges part-time and both full-time. Often college admissions begin in the fall, but even more often today, many colleges like UMass accept students on a rolling basis. Our program at UMass is 100% online, so students can attend and participate in our DNP program, our master's program, and our postmaster's program, all online and throughout any state in the United States. So UMass is just one of those programs. There's so many out there providing amazing education. If the PMHNP role is a role that seems interesting to you, I encourage you to reach out to one of us providers who are out there to learn more or seek more information from directors of academic programs to also learn more. So thank you again for joining us today. And please, if you found this episode helpful, please rate and review this podcast. It will personally help me grow as a nurse podcaster and will also help Nurse.org reach more listeners. So please share it with a friend who could use this information. And please remember to keep self and the care that you give others. Thank you so much.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.